Ryan Jouett from College Station, Texas. I have a general practice there where we specialize in implant dentistry, full mouth rehabilitations. And from the very first time I came to the Pikos Institute, it was very clear that we would be learning only what was not only clinically relevant, but also relevant in the literature. So it was refreshing to have a course that doesn't just quote the literature, shows in the course how to use it in a relevant way to your practice that you can use Monday morning. And that's what's been key to me coming back here. I've gone through the entire course at the Pikos Institute, from the bone grafting to the sinus graft, to all on four, to the soft tissue. All of them works together flawlessly. He does a great job of putting in context each item that you learn about during the course time, and does so in such a way that each time you're here, you hear about the bone grafting course, you hear about the soft tissue course. The sinus grafting course, you hear about all on fours, because you need all of those modalities to be able to treat your patients well. And that's been fantastic for me, because the half-life of the information that we have goes and turns over so quickly that from 2 years ago when I started the journey to today, things have changed. And so I have to continually modify and update. So it's been fantastic for me in that standpoint. Specifically, clinically, from the soft tissue course that we're taking here today, I will absolutely change the way I treat the soft tissue around implants and around teeth. The thickness of the tissue and strategies of how to get thick tissues, especially in the aesthetic zone, have been incredibly helpful. And I can think of dozens of patients that this would help starting this week, some of which are on my schedule for Monday morning. So I'm immediately going to be doing a connective tissue graft along with my grafting prior to the implant placement, and I'm just doing it. So I'm not going to charge the patient for it. I'm just doing it because I know that this is going to work now. Regardless of whether or not we've talked about it, it's going to help the patient, so I'm doing it, yeah. So it seems like there's two types of dentists in the CE realm, right? There's dentists who just do CE because it's what their state board requires to get it over with, and there's dentists who don't want to take any CE course that's just for hours. They want to take it to actually get better. There's very few institutes and learning facilities that you can go to get extremely high quality CE. Pikos Institute is at the top. So if you're wondering on whether or not you should come to the Pikos Institute versus any other place to get training, the Pikos Institute is the place you need to go.